Almost everyone grinds their teeth when they're asleep at night, but how do you know when it's becoming a problem? Because Health Matters, we are joined now by Dr. Steve Mangan to find out more. Thanks for joining us, Dr. Mangan. Let's start out with a myth. A lot of people think that grinding teeth is related to TMJ. Is that the case?
They are related, but they're not the same.
Okay.
Because some people with extreme grinding have very little TMJ symptoms. Other people that have a lot of TMJ symptoms really may not have much grinding going on at all. They may be doing other things causing the problem. So I guess let's clarify a little bit. Let's talk about this whole business about bruxism, which is the fancy word for nighttime grinding. People who have nighttime grinding, which by the way, as you mentioned, almost everybody grinds at some point in their sleep cycle. And if you have extreme grinding, you can have headaches, jaw soreness from all the muscles that you overwork. And get to where you can't open all the way, worn down teeth and cracked teeth and fillings and things like that. So all these symptoms that we listed, you can have a lot of grinding, but only a small percentage of people, about 5%, have actual symptoms of this grinding. You grind, but you may not be aware of it. I've told people that in sleep studies, they can wake somebody up in the middle of grinding and say, hey, were you grinding your teeth? No, not grinding.
And they don't realize it.
They don't realize it, but there are some people who have these bad symptoms. And they can be due to a number of things. It could be because your bite is off, and we have this little neuromuscular thing that makes us want to grind and make it smooth again. You could have a change in your bite. You can have trauma from a car wreck. You can have a lot of stress that may make you want to take out your stress by grinding.
Absolutely.
Something like that. Medications and some illnesses can all add to the amount you grind. But the thing is, if you don't have symptoms, it's hard to get excited about seeking treatment. There may not be any real motivation for you. In this case, though, but if you're having, let's just say you're having pain, or you're having limited opening, other problems that you know, or if you look and you say, you know what, my teeth they look like they're getting worn down, you need to seek treatment. That's right.
The treatment. We're out of time, but what are the treatments quickly that people can?
Well, you can try protective splints, bite adjustment, orthodontics, all the things that eliminate things like your stress. Those can really help eliminate some of the grinding. Bite splints are probably the most productive way of eliminating the grinding.
Wonderful. Thank you, Dr. Steve Mangan. We appreciate you coming in.